Hello, everyone, and welcome to this episode of A Mind of Her Own. My guest today is Dr. Rebecca Thompson. She's a family medicine and public health physician from Portland, Oregon, who specializes in women's and children's health. She's also the author of Held Together, a shared memoir of motherhood, medicine, and imperfect love, a book that aims to expand the understanding of motherhood's true diversity while advocating for empathy, inclusion, and improved support for all women and families. And it is honestly such a beautiful book. So, Dr. Thompson, thank you so much for joining me today.
Oh, thank you for having me and for discovering Held Together and wanting to talk about our stories with me.
Well, it's
Thank
so fun
you.
because I have a dear friend who practices in pediatrics in the San
Hmm.
Francisco area. And she reached out to me because she knew I had a podcast. And she
Hmm.
said, "You have to read this book. This is a
Mm.
beautiful, beautiful book. And I think you should read it and have her on the podcast." I love friends like this. They're always
Mm.
like, "Have this person reach out."
Mhm.
And so, of course, I ordered it right away. And she was absolutely correct. It really is a
Oh,
stunning group of stories. I mean, let's start with, I know that
thank you.
you're absolutely welcome. You described your book as sort of a response to obviously struggles with your own life-threatening pregnancy
Hmm.
losses, rare medical complications, and just how isolated and
Hmm.
alone you felt during that time, and that this is sort of your response to that. Like, let's start there. How did this book begin?
Yeah. Well, I really appreciate the chance to not only connect with you as a fellow physician author, but to kind of talk about our experiences and the process of writing these books. And especially in the way that you're framing this, to talk about what's unique about Held Together. Because I didn't find anything else out there like this, and that's why I wanted to write it. So this idea of the shared memoir, um, as you mentioned, and I'm happy to go into the details, but the big picture is that um, I had a really complicated path to motherhood, medically complicated, and that was incredibly overwhelming and isolating, even as a physician myself. But after I started to open up, initially I had kind of been holding it all back and not really knowing where to start in talking about it with people, friends, family members. Once I did start opening up, I noticed that everyone around me seemed to have a story. They wanted to offer and talk about their own complicated family story. And this was everything from fertility and pregnancy complications like we had been experiencing, but really all through the long arc of family life over generations. Complicated relationships, things that ebbed and flowed in how people saw each other and saw themselves within families. And I just, I wanted to find a way to preserve these stories and help others feel less alone through their challenges and really to make something bigger out of our individual isolated narratives. So to get at that, I mean, I think the format is I think what you were alluding to in asking the question. Like the format is kind of unusual, a shared memoir. Um, I wanted to share our own family story and what it had taught me as a physician and a physician becoming a patient. But I really wanted to capture some of the stories that other people were telling me of these amazing women all around me in my community, from my own patients that I was so privileged to take care of, and medical colleagues who were going through some of the same things that I was going through, or maybe things incredibly difficult, different from what I was going through, but also difficult in their own way. And my friends, I may have known some for decades, but saw their stories in a whole new light. I wanted to bring that all together. Um, capturing those women's voices. I, I think, do you read a lot of other medical memoirs too, like stories written by physicians, right? And yeah,
Mm-hmm.
so I love those. They're so insightful and they give me so much like of a view into how the clinician experiences caring for patients and how they themselves, maybe navigate healthcare for themselves and their families, but they're often missing the patient's perspective. So I really hoped that I could capture this other viewpoint, especially when the patients were healthcare professionals themselves and had these unusual insights into, the healer needing to seek healing. the blends of insight and hubris and humility that that can bring. So,
I love, and the title is so beautiful. I mean, the idea of being held together, that, my interpretation of that, and I know we each kind of have our own, I'm sure I'd love to hear yours,
hmm
is this idea that it can be so isolating, and we are thinking of ourselves as the parent, as the caregiver, as the sort
hmm
of, you're creating this life, but who
hmm
is holding us and trying to guide us and help us?
Right.
And I think your book highlights that. And just reading it, I can't imagine women not
Mm.
feeling less alone.
Oh,
I'm just
thank
wondering
you.
about the title, and then even the end, the imperfect love, and how you describe that. Why is that in there?
hmm Well, I think the title, it has many layers of meaning. And I think that the most kind of when I first was, we all explore many different title options as we're writing a book, and for a long time I just wasn't sure what its title should be. But when I landed on this, I knew, oh, no, that's definitely it. For years it was unsettled, and then it was, I was unsettled with whatever the ideas we'd played around with. And there are basically sort of five core meanings that this has to me, and it's certainly it's multi-layered, and I'm not sure anyone has ever asked me the question before directly. We've talked about the meaning, but like no one has really said, "Tell me exactly what it meant to you." And so the most straightforward meaning, like you're alluding to, is this resilience of women, of people in challenging situations, and which I do prefer to frame as persistence rather than resilience. I think it's more of an active, like empowering idea. But it's about how ordinary women and families are so often the ones who are just trying to hold everything together when things seem to be falling apart. So that's sort of the core idea. And it's also about seeking healing and how our bodies can be physically held together and repaired, after injury, medical complications, trauma, all the ways that we can grow and change and work to heal ourselves even as we heal each other. Then I think the other ideas are like a little bit more metaphorical. Those are the kind of two most literal ideas. And one is, and we're going to talk more about this, I'm sure, but this line we walk between secrecy and trust. So we hold on to our stories sometimes a little too tightly, and then we may find ourselves ready to hold them out to others and essentially make them an offering as we build relationships, which leads to this idea of embracing contradiction. We can hold two things at once or multiple things at once that may seem mutually exclusive or conflicting in the way of emotions like grief and joy, being perfect even in our imperfection as we show up, like all these contradictory ideas that can coexist. And then the last main idea that comes to my mind is about creating community. And coming back to your very first question, how do we bring these stories all together, held in this one collaboration, and put them in conversation, build a community by using our stories that can mean so much more as a whole than any one voice would if speaking out alone.
I think a theme, I mean, certainly I think about guilt a lot because I've
hmm
written a book
Yes.
on it, but I think that comes through again and again in different stories, different women's
hmm
experiences here. And this sense of expecting, expectations are
hmm
so key, expecting to
hmm
maintain control. And I think
hmm
thinking about women in medicine, certainly we're socialized to think, okay, I need to be able to control all variables, take full responsibility for what
hmm
happens. That's really what my job is. And I'm wondering for you personally, what it felt like to be in that circumstance. And maybe you
hmm
hadn't been before, had any health issues or things that you were having to
hmm
go in to get care. Because I hear from so many women this suddenly
hmm
my body in my mind is not working right, or I'm doing it wrong, or now I have to go to the doctor all the time. Like it's a real
hmm
shift and a sense of powerlessness.
Yeah, yeah, this was the first major thing that I had faced. We all have our moments of becoming patients through our lives, but this was the first significant, surgeries, chemotherapies, those kinds of things. This was the first time I dealt with that as a patient. Um, and, I think that question about kind of control, responsibility, expectations, that all ties into the imperfect love idea too that you were mentioning. And because I think, the only guarantee in life is that things will not go as planned, no matter what we plan, right? And this is the most true in parenthood and family relationships. Um, I talk at one point about how these kinds of experiences feel like navigating and traveling through an unfamiliar landscape. And we choose a route, we consult the maps, um, and we set out, but we really never know what the path is like until we walk it ourselves. And that's part of becoming a patient, becoming a parent. Any life transition, right, or period of growth can be uncomfortable and we can feel out of control. Um, I think this, in terms of embracing imperfection, it's a reminder to temper our goals and loosen our grip on those expectations, those details that we've been holding a little too tightly. Um, this also, I think, is a reminder that held together soundly rejects the idea that everything happens for a reason, but we can choose to make meaning in things that happen. And I think this is where it ties really beautifully into your work with that the guilt being in the disconnect between what we expect and what we experience of ourselves, of our lives, of like everything going on around us. So that's where your work really resonates with me.
Yeah, because you could see the different types of expectations that I brought in from women I saw in my practice. They
Hmm.
existed out there, and I just sort of grouped them together, come up again and again. This idea of sort of
Absolutely.
constant caretaking is what an ideal woman would do, even to her
Right.
own, detriment. Hyper accountability, being able to actually control someone else's feelings.
Right.
Perfection, certainly struggling with infertility, struggling with
Hmm.
complications in pregnancy, or even if your child's having issues,
Hmm.
this feeling that you're just not getting it right, that you're somehow wrong. I was so struck. There was this really simple moment or description, but it really reminded me of this belief we have as parents. And that is, I think a woman named Tess was describing she had a daughter who was, it sounds like maybe struggling with colic or just really, really crying and tearful and difficult to soothe from a few weeks in, gosh, almost up to a full year. And then she
Hmm.
had this second daughter who was much kind of easier to soothe and a little bit lower, low key. And she said, "Oh, it's not this that I was a bad mother, right? And then I was messing something up. But like, she's like, I guess I knew that, but I didn't know that." And it was such a
Yeah.
relief to sort of see that with my second child. And I think that happens a lot where that second child, you're
Yeah.
like, oh, they came out totally different.
Who,
And I
who
didn't
they
do anything
are.
different. Right.
The really fascinating thing about that story too. So Tess's story is the first one you encounter in the book after you hear a part of my own. Then, my story is broken up into chunks, and each other woman's story is told as her own individual, self-contained essay, if you will, at a point where her story intersects with mine. And Tess is one of my best friends from medical school. So now, gosh, more than 25 years. So we've grown up. Our kids are all teenagers now and thriving, knock on wood, thank goodness. And but she's a child psychiatrist. So it's all the more poignant because she, with Elena, with her first daughter, she's like, I know I'm not being a bad parent. I know it's not my fault. I shouldn't have the guilt, right? I should reject that, but I still feel like I should be responsible, like I should be able to be in control. Um, and so it's a really challenging kind of contradiction for her that she's supposed to be an expert in all things managing behavior and advising people about mental health. And she is just not able to do that within her own family, and it's completely outside of her control. It's it touches on that idea of imposter syndrome, but it goes, so much deeper. Like, am I some kind of fraud? She asks, if I can't even care for my infant and I'm supposed to be an expert advising all my patients and their families.
Yeah.
It's such a beautiful story, hers. Yeah.
It is, and I think it's certainly something I've felt as well, that there's this expectation of myself, but I do receive it from
Hmm.
others. Like, well, you
Hmm.
should be able to figure this out. Like, if your kids are
Right.
having a tough day or they're anxious, no problem. I'm like, well, I wish I could be totally objective at times, not
Right.
always, but it is
Right.
really difficult. And I think when you're in both of those roles, I'm really interested in how you, as sort of a patient, and then even going through a molar pregnancy and
Yeah.
having the complexity of that and having to go through treatment and chemotherapy, like what you now bring to your work with patients. It must be
Yeah.
so many things.
Yeah, it's true. I mean, I think medical knowledge, it's really helpful to have that medical knowledge when you're a patient navigating the medical system. It is a real privilege, right? We bring that. We bring that part of being a doctor, learning to be a doctor while becoming a mother, all of those layers. Um, it's a privilege to, mostly understand what's happening in your body, maybe scientifically. But becoming a patient is an entirely different experience, whether it's yourself or your child or your partner or a close family member or friend that you're helping through. Um, when I was a patient most acutely during those times, and even now, sort of when I'm with my kids or my husband or someone else helping in a medical setting, not as a physician, but as a like support person, I feel like I always have to disclose that I'm a doctor, but I want to do it in the most humble way and like ask them, speak medicine to me. I speak medicine, but I may not be fluent in your dialect. Like I'm not a specialist. I still want to be treated just like an ordinary patient, not a doctor. I still want all of your wisdom and advice caring for us. Because like you said, I can lose so much objectivity when it's close to home. Um, but I just want to be treated like with respect, like any patient would, acknowledging that knowledge I have. And then, so when I look at this from my perspective as a doctor, as you asked about when I'm caring for others, I think that is in some ways the more interesting question because, um, as you know from reading the book, it's like, what did my patient experience inform in my own practice? It completely changed my career. So when I first went through so it was three pregnancy losses, including two life-threatening to me, very complicated medically. I went back to do a second residency in family medicine. I had been working in public health at the time. And it felt like this idea you write about also feeling dissatisfied pushes you to grow. It's like I got some really dismissive care that I wanted to do better than. I was learning so much. I wanted to make the system better for other women and families in ways that, I had been blown off, frankly, during my care. But I'd also received some life-saving care, literally. And I wanted to pay that back. And one thing that's really, I think, really interesting about what the structure of Held Together allowed me to do is here's one example. You meet Devora, who's an obstetrician, my obstetrician, in the emergency room when I'm in the midst of a crisis in one of these pregnancies that becomes life-threatening. She's the on-call senior resident. Um, and, we just meet by chance. But she goes on throughout the book, throughout my life, in real life too, to care for me over years of managing that pregnancy complication and then others, and ultimately delivering one of my children. And she's just this steady presence through the story and through my life. She's still a treasured friend now. And as a reader, you see her from my point of view through the whole book. But at the very end, you get to read her story. And so you learn how she became this amazing, compassionate, insightful clinician who was able to care for me in just exactly the way she would have wanted to be cared for if our situations had been reversed.
Mm, that's beautiful. It's such a powerful way for it to be full circle and to be able to see.
Thanks. Yeah,
I
and full
love
circle is
that.
exactly part of what I say is like everything had kind of come full circle
Yeah.
for me, for her, for my child who, she then delivered. Like it all nothing is perfect. Back to that imperfect love, but like
Hmm.
things finally felt like they were starting to make sense and come together in a way that we could never have envisioned them working out when we were in the thick of the crisis.
Right. Something I talk to a lot of patients about who maybe are struggling with depression, for
Hmm.
example, is just when they go and do something in the midst of that depression, something very simple like getting dressed, showering, leaving the house may feel so big,
Hmm.
so exhausting. But and allowing them to see that the context is important and where they're at is important. And I
Hmm.
think there were a number of situations, one, Victoria
Hmm.
saying, I didn't think to call it brave.
Hmm.
And this idea that we don't always know how brave or how strong we're being because we compare it to some outside measurement that doesn't
Hmm.
really address what we're coping with and how we're continuing to be persistent in the face of
Hmm.
that.
Yeah, that's a great point. Um, I think that kind of, I didn't think to call it brave. It's that quiet, invisible bravery that I think that's the core of what I think of as persistence. When I was talking about that earlier, just touching on that and as like what the title means, that holding it together, holding ourselves together, holding our families together. It's this willingness to confront ordinary but often dramatic challenges and keep moving even in the face of uncertainty. And sometimes we're too busy just living our lives to notice how remarkable they are, how remarkable we are. And it's interesting when I first talked with each of the women about collaborating on this book, and there are 21 other women's stories in here. They're all people that I know from some portion of my life. There's no one that I just kind of recruited because I wanted a certain kind of story. These are just the women who happen to be in my life, which I'm so fortunate to know all these amazing people.
Yeah.
But many of them, even if they were interested and said, "Oh yeah, I'd love to hear more about what you're going to do with this," and this was, 10 years ago, more than 10 years ago now, as we started working on this project in 2014. Um, Many of them were like, sounds really interesting, but my story is not anything. Like, why would you want to hear from me? I'm not
Mm.
especially brave. I'm not especially interesting. Um, but I disagree. And I disagreed kindly with them and like convinced them, or said, well, let's just see what we get and where it goes, and you can decide later if it's working or not. But I think these stories are all about those extraordinary moments in ordinary lives. And to me, those are the most interesting things. And I'm not that compelled by sort of prominent, famous thing. Like I want to hear about ordinary people getting through their regular days. And so that's what this book is.
That is amazing when you think about it. I mean, I sort of knew that you described that throughout, but the fact that these are just all women in
Yeah.
your circle, as opposed to because they are such remarkable
They
stories,
are.
you
But
know?
we could walk up to anybody on the street. I mean, everybody's got a story like this, and we could walk up to them with their consent, publish a story like this for anybody. And I think it does go back to the methods. Like when I say I wanted to capture the perspective of ordinary people and my patients and my colleagues who had become patients and new perspectives on my friends, um, the way that I wanted to do that was really to invite them into a collaboration. I really intentionally use that word collaborate or collaborators, not contributors. This is not an anthology. This is a project where, so for each of them, we used hours and hours of recorded interviews and we just talked about her story. And then I transcribed that and would not use it word for word, but really try to capture many of the phrases she used, the expressions, the way that she speaks, and try to shepherd her voice. And then I would give it back to her and we would do iterations, probably for most of the chapters, I'd say like easily dozens over several years for each chapter, the whole project being about 10 years, but each individual chapter, several years at least. If she had maybe journal entries she'd written or emails to friends and family during a moment of challenge that she'd kind of explain, updates to family and friends, she shared those with me, anything I could incorporate. But I wanted to help her create the most compelling version of her story that we could and make it read like fiction. Like you have a, you drop into the scene, you have a narrative arc, character development, you have the setting, and you're describing physical surroundings and how those impact what you're going through. So to bring out those themes in partnership with her was a really different experience from just saying, let's throw some essays together. And that was what was so rewarding, was really working closely with each of these women and developing their story to that kind of polished but true idea of what had happened to them and how they'd responded to it and what they'd learned. And yeah.
And there are a number of different aspects of grief and stories that incorporate grief. I mean, throughout, whether it's a miscarriage, whether it's challenge becoming pregnant, whether it's a
Hmm.
loss of a child later or of an other family member when you're in the midst of this. And I'm just wondering kind of what your thought. I think grief can be something I certainly hear from people that's so hard to know, like, how am I supposed to do it? What's the right
Hmm.
way to grieve? And I think there can be these sorts of losses that are not, maybe we don't talk about them or share except with very particular people. And so how do
Hmm.
we cope with that? And I'm wondering kind of what you learned about the process of grief in writing and hearing these stories.
Yeah. I mean, it's always pretty hard to generalize because there are so many different kinds of grief experiences that can cause grief and ways to help others dealing with grief, ways to deal with grief ourselves. But I guess taking the experience, as you mentioned, of pregnancy loss as one example, because that comes up several times, of course, in the book, even though it's a long view. This is not just a fertility and early pregnancy and early parenthood book, but um, I think it's a reminder, the variety of stories, the variety of ways that we experience grief and loss and challenges. It's a reminder to take into account that there's always so much history and context. It's not just the one experience. You have to know. So let's say, if you're in the position of being the doctor working with this patient person, let's say, but who happens to be a patient in the patient role at this moment. Um, what do you know about them and the other aspects of their life? How did they feel about the pregnancy? Again, just with this example, what other responsibilities are they balancing with their physical recovery? Other kids, jobs, partner, life experiences, life situation. And, all that said, I think what it taught me or what it reinforced in me from an emotional standpoint is that the most thoughtful approach we can take is to never assume that we know the meaning of an experience, whether it seems like a so-called good experience or so-called bad experience, on someone's life, because like this might not have been a desired pregnancy. We don't know that if they're having a miscarriage, if we learn that, if they even share that or whatever is going on. They may have a more complicated relationship with their partner or the person who is, otherwise responsible for this pregnancy, if that's their partner or not, than we realize. The way they understand their experience could be really colored by events that you have no knowledge of and they don't want to talk about. And that's their right. So I think just conveying, as in the physician role, that we care, that we're sorry they have to go through this, acknowledging that it's difficult, whatever it may be, and that we don't know exactly how they're feeling, but we're available to support in whatever way we can. I think that's the lesson, or just to do nothing and sit together in silence if that's what works for them too. That's
Hmm.
silence is not nothing.
Right, right. I think I work with, residents in psychotherapy sessions and helping
Hmm.
them learn how to allow
Hmm.
some silence, which is
Yeah.
really powerful. Right.
Yeah.
We as humans, we're such storytellers. We rely on stories. That's sort of what we've, for eons, relied on to communicate and connect and express moral truths and ethical truths. And I'm wondering, as these families, women who have been part of this book, have they reached out to you after reading it and found, I'm sure, any number of responses, but what sort of feedback have you gotten from them first? And then I'd love to hear more about readers, but as far as reading their own story that you brought out.
Yeah, several of them have said to me in different ways that working on this project it was the first time, well, one person said recently we were presenting together at like on a panel because I've been so grateful to do a lot of events with some of the collaborators if they're local here or sometimes traveling and meeting up with them other places and um or virtually. It's just been so rewarding. And one of them was talking about how she actually didn't think she'd ever sat down and really told her story in any sort of cohesive way to anybody. And this is someone who's married and has a wonderful community of people around her, and like it just doesn't happen. And it was the first time she had made some kind of sense and bigger picture out of her story. And I hadn't realized that. And this was just a few weeks ago. The book came out last April. So even that, I hadn't I hadn't known that. And that was so touching. And many people said, even during the process, over these past 10 years, that this has been the first time by framing their story in this way that they've been able to, I don't want to say move past it. I don't think we move past challenging experiences. I think we integrate them into our identities and into our wisdom that we carry forward, right? But that this was the first time she was able to to understand her story in a way that allowed her to move ahead with it, not feeling kind of stuck in it somehow, mired in those difficulties, but carry it in a way that was useful and had some, if not joy, at least resolution and purpose.
Yeah. I had just interviewed a woman who works with a lot of postpartum mothers and parents in
Hmm.
general who are struggling a lot with anxiety and in that
Hmm.
directly having had a baby and described
Hmm.
pregnancy and delivery as a normative trauma.
Hmm.
And I think when I think about the work that we do with patients who have struggled with trauma or post traumatic stress disorder, or, to be able to have a coherent narrative of that traumatic experience is really, really powerful because it's often
Hmm.
clips or bits, or we miss parts of it, or there's something we're blaming ourselves for that when we actually say it out loud, we start to understand, oh, okay,
Mm.
what were the
Yeah.
areas, what was the locus of my control versus what I'm trying to take responsibility for. So I think that's a really, it's got to be such a powerful experience to be the people that you've written about.
Yeah.
I wonder if a reader is thinking that or is listening and is saying, gosh, I want that opportunity, right? I want to have this chance to tell my story. Like as you've been talking out since the book or even while working on this project, have you
Hmm.
heard from other women or other parents who've found ways to talk about this in a unique location or place, or what have you heard from listeners or readers?
Yeah, I do feel like a common thread of feedback has been that people do feel less alone reading these kinds of stories. And um, I would say, I at the beginning of the book, we all have an introduction. I really intentionally titled ours an invitation. And that last line of the introduction, the invitation, is an attempt to invite the reader to see themselves in our stories. And that's, we hope that you will find yourself among us and know that you are not alone. So, by find yourself, I mean for the reader, both that you will end up here traveling alongside us, find yourself here as our stories unfold, and you feel like you're just listening in, like to a friend telling a story, maybe on a road trip or on a walk or sitting over a cup of tea. But also find yourself that you will recognize yourself in these stories. And so that's the most rewarding thing I'm hearing from readers when they feel that, because the details are so specific in these stories. Many of them are pretty extreme examples of things. They're ordinary people, but they are extraordinary moments. And most of us are like, well, that's never going to happen to me, right? But you have that initial reaction and you keep reading, and at least for me, and this is what I hear from readers, is, oh, but I feel completely like this resonates with me. The details are nothing like my life, but the themes, the experience of having a hard season or grappling with something in your family, these themes are universal. And so this is where I say to readers, if we got through these things, this is what the book tells readers. If we got through these things, you can too, because you're just one of us.
And I think this concept of post traumatic growth is really important, but I think you describe it in this metaphor in the book, which with a much more poetic description, which, and I'm probably not going to pronounce this right, but is it kintsugi or okay, kintsugi?
I mean, it's not my native language and culture either. It's from Japanese, but I believe that's correct.
Okay.
I don't mean
Which,
to appropriate it, but I think it's a beautiful, yeah. And the story we talk about, the woman whose story it is, her family is Japanese American, but yes,
yeah.
that's one of the metaphors.
Could you just describe, I think it was in your patient Eriko's story,
Hmm.
but I think that the post traumatic growth piece, it certainly applies in sort of finding something beautiful
Hmm.
in the broken pieces, so to speak, to
Yes.
finding some way to keep going. So, can you share how that
Yes.
applies?
Yeah, so Eriko is one of my medical colleagues. I've never cared for her as my patient. She is someone that I've known, as a friend, as a colleague, and saw her, actually really met her after she'd gone through a lot of what was described in her chapter, not all of it, but partway through this. Um, and her story in particular, so it references this Japanese art of kintsugi, which is essentially this tradition of repairing damaged objects, art, ceramics, pieces of physical pieces, with a line of golden lacquer and bringing them back together. Again, holding them together, another theme, right? But it really embodies this beauty that we can find in imperfection. And Eriko uses this metaphor. Like we open with this metaphor and talk about her family's history as Japanese Americans and how relevant that is to her experience, her career choices, her understanding of self and what a woman should be and what motherhood means. Um, and she reveals these sometimes broken relationships that merge then into reproductive health failures and challenges of all kinds, but led to this complicated and loving family that she has now that she never would have envisioned when she started out. But those cracks, those prior losses and disappointments and difficulties, those are the things that run through her story to bind her family together and remind her of how they've healed, right? So I hope that our readers see in our stories that, like, many of us were broken by what happened to us. Don't get me wrong, these were really challenging experiences, but these are hopeful, optimistic stories. They're not sad, they're difficult, but they're about how we put ourselves back together even stronger than we were before.
And clearly, that what you've taken is from your own personal experiences
Hmm.
and then bringing all of these stunning stories. I mean, I did
Hmm.
feel part, this sense of community, which has been on my mind
Hmm.
all the time lately, is in this sort of fractured environment of our country and beyond.
Hmm.
And I'm thinking, okay, one of the things I've worked on with my book and I really want to try and move forward are doing sort of guilt-free groups where women
Hmm.
without me, trying to tell them how to do it, but they take the book and they explore it together and they talk to each other and they grow
Hmm.
together and they process and try to figure out how do we lower our guilt with these strategies and ideas through our own
Hmm.
solutions as well. And I'm
Yeah, that's
wondering,
great.
like, if someone out there, you've done this incredible job of bringing this together, like if another person out there is saying, oh, I want to do that, I want to create
Mm.
something like this to build community, to bridge, what kind of ideas would you have? Like, if you just dream, what would it look
Hmm.
like if this were to kind of start a movement around the
Mm.
country?
Well, in the motivation for that, I think, is perfectly tied into that idea of kintsugi. It's about being willing to show up, like receiving this as an invitation to see things in creative new ways, find the beauty in the unexpected, and believe that imperfect can be the perfect way to be in community with others, especially. And so, I think that one one thing I would remind people is that none of this happened quickly or easily. This whole project, all my experiences, none of it made sense in the beginning. None of it happened. without constant pivoting, right? And I want people to know that it's okay to take time to find that path, to find their people. I think building community, we sometimes just expect or hope that we can create something in a kind of a sudden way, like it's just there and we tap into it, or we bring everyone together and everyone is synchronized in their experiences, in their desire, in their goals. That's rarely the case. Much more often, it's the individual one-on-one or small group relationships that form that foundation. And so I think I would just encourage people to know that no matter what your story or your perspective or your hopes, like your people are out there. You may not have found them yet, but they are out there. And if you can just start finding them one at a time, even, that's going to be the beginning of something that you can make bigger if you choose to. Also, I think on a very practical level, remembering that small actions add up, small relationships add to bigger community, but small actions add up to bigger projects, if you will. So most of this book, most of Held Together, was written in small moments in between things. And I know this is for you too. You've written, I know, about working on a chapter while sitting outside of one of your son's sports events, or just like in those in between moments. And that's how most of this was written too. So even if I only had 20 minutes in the car pickup line, I would always have my lap. I'd get there early so I could be parked at the front and not have to move ahead, so I could safely open my laptop and work for those 20 minutes. Um, and that's why it took so long to write this book. That's part of why. Also, it just needed to evolve with those relationships over 10 years. But so I want people to know that they can take tiny steps in whatever facet of their life, and those can add up to something really meaningful and really rewarding with time and patience and persistence. We're back to persistence.
Well, I feel like in connecting with you and hearing about the work that you're doing and us sort of pushing ideas back and forth to each other and really finding so much that resonates, that this is one of those little steps for me today. So
No.
thank you so much for joining me, Dr. Thompson.
Of
I wanted to
course.
just show everyone this is a beautiful cover. I know that,
Thank
I
you.
mean, the title as well, but just a stunning cover. And where can people find the book, find out more about you, and try to connect?
Yeah, thank you for that. I'm really grateful for the work that our design team and cover artist did. I think they captured the spirit of our stories so perfectly. So if you like the cover, I think you'll love the book. It really embodies the spirit of it. And I kind of asked them about certain colors, and there's, the salmon color for my Pacific Northwest heritage. There's a little bird because, Portland put a bird on it, kind of an inside joke, but it's really meant to convey that spirit of the wilderness of motherhood.
Mm-hmm.
So yes, please find me and more information about the book on my website. It's RebeccaNThompson.com. The N is important because there are a lot of Rebecca Thompsons, and this is my only book. There are other authors named the same thing, but use the middle initial. Um, you can find, reviews and book club discussion guides, on a lot of book club discussion guides, resources for medical teaching, medical training. One of my really big goals is, and I'm starting to move into this after the book's been out, and I've done kind of the traditional publishing book tour parts, a lot of that. I'm looking to move more into medical training. And I'm really grateful. I'm starting to meet with medical students, residents. I'd love to work more with, nurses, doulas, midwives, social workers, psychologists, anyone who wants to understand their patient's context better, and the next generation of trainees. So please reach out to me. There's a connect page on the website where you can, it just emails me directly, just message me through that connect form. If you have ideas for this, I can do virtual. I'm doing virtual events around the country too, so that's always an option. And if you are able to support the book, just, to get a copy, we also have on my website affiliate links on the order page where a portion of the proceeds go to Postpartum Support International, which is an organization that supports maternal and family mental health. So if you're able to buy a copy through one of those links, and that'll send a portion of the proceeds, or through your local bookstore, we have links to find your local bookstore on there. But really, I think just anybody who can read it, get it from the library. If it's a financial concern, tell your friends about it. What you said at the beginning, Jennifer, about your friend recommending it, that is the absolute best compliment that I feel like this book, with its cover, with its inclusivity of broadly defining motherhood and family and looking at all these angles, it's the perfect book to press into the hands of your friend and say, oh, you have to read this so we can talk about this, or because I think this will resonate with you or help you heal from something you've been through. And so thank you for spreading the word. Anything you can do to get into the hands of other people that it can help and speak to. And that's just the biggest honor to me. So thank you for doing that.
Oh, this has been such a wonderful conversation. And like I said, I would recommend this and will be passing it along to other people in my circle. So
Thank you
thank
so
you.
much. It's great to connect with you here as a fellow physician author and explore all these ideas. So
And listeners here, just keep in mind that we're both physicians, but not your physician. So if you have any healthcare concerns or questions, please don't hesitate to reach out to your own provider. And thanks so much for listening.